Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're tackling a question we hear all the time. Who are all these people in white coats? MD, DO, PA, NP, resident, fellow. It's enough to make your head spin, right? So let's talk about that a bit more. Joining me today is Christine, a member of our team. Welcome, Christine. How you doing?
Hi, Dr. Borelli. Hello, everyone. So today is very interesting because our goal today is to help you understand the differences between these healthcare provider titles. I know a lot of people are very confused about that, and even me, to be honest. Yeah, and more importantly, how it affects the care you receive, right?
Oh, of course. Yes, that's a great starting point.
Yeah, let's start with the most familiar one. The word, quote unquote doctor. What exactly makes someone a doctor?
That's a great starting point. So, a doctor, also called a physician, is someone who's completed medical school, but that's not the end of their training. Most doctors go on to complete several years of residency where they train under experienced physicians, and some even continue with fellowships to become specialists. So, when you meet a doctor, you know they've gone through years of rigorous education and hands on clinical experience. So, well, that kind of makes sense. There's more confusion that's added now. So,
Exactly.
typically, when we think of a doctor, we think of like an MD or a DO. Well, now there's also doctorate levels of different specialties too. For instance, PAs can get a doctor of medical science, and NPs can get a doctor of nursing and things like that. So, it does add to a little bit of confusion. Sometimes residents will also call themselves doctors, however, they're still in resident training. So, the confusing part is they all wear white coats. So it's a very
Yeah,
tricky to understand, who is who. Students also wear white coats, so that also adds a little bit to the complexity of that.
exactly. Yeah, I agree with you. That's super helpful. So, what's the difference between an MD and DO? Aren't they both, doctors?
Yes, both are doctors, MDs and DOs. So MD stands for Doctor of Medicine, DO stands for Doctor of Osteopathic Medicine, and they are licensed physicians. The main difference in their approach is how they are taught to approach care. MDs are trained more in an allopathic medicine, which focuses more on diagnosing and treating specific conditions, often with medications or surgery. DOs receive similar training, but with additional focus on whole body wellness, preventative care, and osteopathic manipulative treatments.